Okay, so we're going to talk about hair loss and myths and realities of that. Part of my practice, I have a hair clinic um, twice a week, and then I also see patients with hair loss throughout the week. So when we were talking about hair loss, you always want to remember that there is a lot of variation of normal. So this is my family's example. These are my nieces and nephews. And you can see, some of them are very well endowed with hair. These two are siblings, her especially, right? And then they have some, but, it's a little bit thinner. And so there's a variation. Okay. So we're going to start off with just nuts and bolts, what I call hair 101, what's normal in general, normally accepted in the medical literature. And then we'll talk about hair loss. There's a lot of different types of hair loss, a lot of different causes for hair loss, but we'll talk about more or less the common ones. And then we'll talk about treatments for hair loss, prescription medications that we use, but also the things that are available over the counter, what types of supplements might be helpful, and what are really just gimmicks. Okay, so normal hair. So the total number of numbers of hair on the body is estimated at about 5 million, but that counts all those little baby fine hairs, what we call vellus hairs. They're very small and short and fine white hairs. Kind of everyone has them on their face, and the baby hairs. The number of hair follicles on the scalp is estimated around 100,000, which is kind of a lot if you think about it. And there's variation. So blondes tend to have finer hair and have more hair than about 20% more than average. And redheads, they tend to have thicker hair, and it tends to be, so then they have 20% less than average. And then also talking about density of hairs, it generally does decrease with age. So it's normal to have a decreased density of hair as you get older. And African Americans and Asians have thicker hair. They also have a lower density of hair then covering their scalp. The normal rate of shedding is estimated at about 100 to 200 hairs per day, but I find in my practice that that's probably some people say 50 is normal for them. Some people probably not more than 200, but somewhere around there. So there's a lot of variation by person and seasonally too. A lot of people shed more in the winter, some more in the summer, some more in the spring. It kind of depends. And then the rate of the hair grows about 1 centimeter every month or 1 inch every 2 months. And again, there can be some variation in that. Some people come in and say, oh, my hair normally grows much faster than that. And that might be normal. And then the size and the shape of individual hairs. So Asian hair is accepted as circular in its shape. If you look at the actual hair, and it's a little thicker, 120 microns or micrometers. And Caucasian hair tends to be more elliptical, kind of oval in shape. And it's smaller, it's thinner, it's 50 to 90 microns. So you can see that even just with normal hair, there's a lot of variation. Now, it's important to understand the hair cycle when we talk about hair growth and hair loss. There are 3 stages of the hair cycle. It's anagen, which are in the growth phase, and the majority of the hairs, 85 to 90%, are in this phase. They're in this phase for about 2 to 6 years, and then each individual hair that goes through this phase will then go through what's called the catagen phase, or the transition. And this transitional phase is very short, about 2 to 3 weeks, and only 2 to 3% of the hairs are ever in this stage, sometimes even less. Some people will say 1%, less than 1%. So it's hard to catch hairs in this stage. Oh, wait, I'm going back. Yeah. There, okay. So, and then the telogen phase is the resting phase of the hair cycle, and 10 to 15% of the hairs at any point in time are here. And that's where the number 100 hairs per day shedding comes from, about 10%. And this hairs last in this phase about 3 months. And then at the end of that 3 months, the hair falls out, because it's pushed out by a new anagen hair that's growing. Okay, so in a lifetime, then that averages to about 10 to 20 cycles for scalp hair. Some people have a very long anagen phase. So Crystal Gale, thank you very much. Crystal Gale, who had hair all the way down to the floor, she had a very long anagen phase. So her hair just kept growing and growing and growing and didn't stop to fall out. Some people, they can grow their hair down to the lower back, and some people can only grow it to the shoulder. And that also tends to shorten over time as you get older. So people, as they get older, may not be able to grow their hair as long as they used to.
Can you tell us why?
It's probably just genetically programmed that way. I think if we understood why aging, the aging process happened, then that would be, that's probably part of the aging process. And then also in terms of hair, all hair does this on the body too, but the anagen phase, the growth phase is shorter for hairs like the eyelashes, eyebrows, and body hair. So that's why your hair on your eyelashes doesn't grow, as long as the hair on your scalp. So some of the myths and realities about hair. So one very common thing is that hair grows back faster if I shave it. So in reality, it doesn't. Shaving or plucking or any other method of removing the hair doesn't actually change the actual production of the hair. What it does is that if you pluck or remove a hair that's already in the telogen phase, already shedding, like going to shed at some point, sometimes that induces a new hair cycle to start more quickly. So the new hair grows out, and it seems like you just plucked it and a new hair grew out. And so it does do that, but it looks like it's thicker than it was. But in reality, it's not really changing anything. And then another one is about gray hair. A lot of people talk about stress causing early graying of hair. And really, it's family history. There was a recent study that showed that smoking and obesity were related to early graying of hair in men specifically. They didn't look at it in women, so we don't know for sure. But typically graying starts in the 30s to 40s at the temples, and then by the 50s, 50% of people have at least 50% gray hair. So that's what's expected to be normal. Now, alopecia, we're going to move on to hair loss next. So hair loss, alopecia, is kind of the medical term that we use to refer to hair loss in general due to any cause. It comes from the Greek word alopecia, which means fox, and it probably originally came out from fox's mange, where they lose their hair kind of in these patches, and they thought that was very descriptive of what happened in some humans. Now, like I said, alopecia we use as a term to refer to all types of hair loss, but originally it was used to refer to alopecia areata, which is a particular type of hair loss we'll talk about in a second. And sometimes it gets confusing because people will say, oh, do I have alopecia? And they're coming in saying they have hair loss. I'm like, well, you just told me you do. You have hair loss, so you have some type of alopecia, but you don't have alopecia areata necessarily. So it's important to distinguish those. That a lot of times people will just shorten alopecia areata and say they have alopecia, but if you have any type of hair loss, you have some type of alopecia. So the types of hair loss we divide into primary and secondary. Primary being just that there's no really other underlying cause or explanation for the hair loss. It's just the hair loss itself. Secondary means that there's some other direct cause. So like a surgery, some people have surgery on their scalps due to an accident, or they have a burn or something like that. That might cause hair loss secondary to the surgery that was done, or the scarring. Cysts, which are little growths, they can cause hair loss sometimes. They just occupy the space, keep the hair from growing. Fungal infections, rashes, things like that. Other things that something else is causing the hair loss. We're going to talk about primary hair losses in this case. And then we divide them into non-scarring and scarring hair losses. So non-scarring, the hair follicle, which is right here at the base, is still present and can produce another hair shaft, which is the hair itself. So there's basically in a non-scarring hair loss, there's no destruction of this. It's all intact, so it can always produce a new hair. Scarring types of hair loss, for whatever reason, this whole thing has been destroyed. And so you can't produce a new hair there. So one thing that people worry about when they start learning about different types of hair loss is that one type of hair loss they're diagnosed with, maybe they'll develop another one. So if they have like a non-scarring alopecia, and then they're worried that they're going to develop a scarring alopecia. Now, it's possible to have more than one thing. You can always have multiple diagnoses, but most of the time, you're not going to, if you have one, it's not going to turn into another one. And most of the time, you're not going to have another one. So each cause of hair loss, each type of hair loss is an individual entity with a different cause. So specifically, if we're talking about non-scarring alopecias, the most common is something called telogen effluvium, and then followed by androgenetic alopecia, or male and female pattern hair loss. Traction alopecia I'll touch on briefly, and then alopecia areata, which we talked about a little bit already. And then scarring alopecias, these are some of the names. They have very long names, all of them, and they're much less common, but I'll show you some pictures just so to be complete, so you can see what is out there, and if anybody has this themselves, it may be helpful. All right, so telogen effluvium is basically an acute increase in shedding. Now, if you remember that word telogen, that's the resting phase of the hair cycle. And effluvium basically meaning like a wave of it, a huge wave of it. So what happens here is that prematurely there's conversion of hairs in the growth phase, the anagen hairs. They convert to telogen, or sometimes you get a big wave of this after there's a prolonged anagen. For whatever reason, something made your anagen phase longer, and so then more hairs are going to then go into the resting phase than usual. So triggers, surgery is a very common one. Pregnancy is also a common one. Pregnancy often prolongs the anagen phase, and so afterwards you get a big wave of hair loss. Fevers, different types of medications or drugs, dieting, which is basically because there's a big stress to the body, and changes in weight. Traction, where there's tension on the hair also. Health problems, like thyroid disease is a very common culprit, and anemia. Sometimes it can be a psychosocial stress, a major life change or event. Sometimes a death in the family, things like that can trigger a telogen effluvium as well. So the shedding usually, so this is really, we talked about telogen, and we talked about how that at the end of that phase, there's a big shed there's a shed of the hair. So this telogen effluvium is characterized by increased shedding. People will come in and say that they see clumps of hair. All of a sudden, they notice clumps of hair coming out. And hair's everywhere in their food, and they're on the floor, in the bathroom. So the shedding usually starts 3 to 6 months after the event, but sometimes it can occur sooner, a few weeks. Even not usually sooner than that, but a few weeks after. So then sometimes it's hard to remember, it was 3 months ago something happened, and then now it's falling out. But that's because the shed happens at the end of the telogen phase, which lasts about 3 months. Now the shedding should last about 3 to 6 months, and then you see visible regrowth or recovery. If you come in to see me, I can see, I have a much better vantage point than you guys do for yourselves to see regrowth. So I'll look at the side, I'll look at your scalp from the side, and I can see these tiny little hairs. They might be only like this long, about 1 centimeter or half an inch, but I can see that it's growing back. But sometimes it's hard to really see the visible recovery for a while. And then sometimes it's interesting, some people will note that there's some pain or itching associated with it. The scalp sometimes looks a little bit red, but usually there isn't really a rash or anything like that. And for me, I think that the hair follicle has a lot of nerves around it, and it may just be that as the hair is falling out and cycling faster, the nerves get irritated a little bit, and so then some people are more sensitive to that than others. So this is that same slide earlier about the hair cycle. And in telogen effluvium, what happens is that this 10 to 15% will turn to 30% or more. So it's pretty dramatic to have 3 times as much hair coming out. To some people, it may even seem like more than that, but it's somewhere around there. So that's why it looks like clumps are coming out. Now, this is from one of our major textbooks, Causes of Telogen Effluvium. So shedding of the newborn. So when the newborn comes out, a few months later, they often have a shed of their hair. So that's just normal. Also after pregnancy, postpartum. And then there's an entity called chronic telogen effluvium where it lasts longer than 6 months. And this, we don't really understand why the hair cycle usually resets itself after an acute trigger like this, but sometimes it doesn't. And so people with chronic telogen effluvium will either just continuously have increased shedding, or they'll have increased shedding, it'll get better, and then they'll have increased shedding again a few months later, and it'll get better, and then, so they kind of end up in this cycle where their hair cycle hasn't really reset itself. And then we talked about infections and fevers, illnesses, crash diets especially, and thyroid problems, and then medications. And on the next slide, we have a list of medications that often cause shedding of hair. What I tell people is just about any medication can cause hair loss. So if you notice here, NSAIDs, like ibuprofen, which is Advil or Motrin, naproxen, which is Aleve, those are listed as possibly causing hair loss. It's not that common, otherwise I think everyone would really be dealing with this, but it can. So, but big culprits would be things like warfarin or Coumadin, beta blockers, which a lot of people are on for blood pressure and for heart disease. Lithium, not as many people are on that. It's for psychiatric problems. And then retinoids, things like, also not that many people are on that. That's like Accutane for acne. There's some other drugs that are in that class. But even antibiotics. So just about anything can cause hair loss, put it that way. So here's one that comes in commonly. If I wash my hair less hair will fall out. A lot of people, when they're shedding, a ton of hair is coming out, the first impulse is to wash their hair less because so much comes out when they do wash their hair. The truth is that the less often you wash your hair, the more hair will actually come out when you do wash it. So normally, if you're losing about 100 hairs a day, and then now you're losing 300 hairs a day, if you're not working it out in the shower by washing it, then you're going to get more hair when you do work it out because it's loose anyways, it's shedding anyways. It's just a matter of are you getting it out of the hair that's there, or are you just leaving it there? Let's see. The other problem is that if you don't wash your hair as much, then sometimes you're making the scalp less healthy. You're leaving oils there, making it irritated, and more hair may actually come out as a result of that. The other thing is if the hair's kind of loose and it's just sitting there in your hair, it may cause more tangles, and that might make the hair fall out a little bit more easily. So how often you wash your hair doesn't really affect the overall amount of hair that you lose. And I usually recommend people just to go back to their normal hair washing. If they are having a particularly unhealthy scalp, we'll talk about how to treat that. But I may ask them even to increase how often they wash their hair. So. Another one. At this rate, all of my hair is going to fall out soon. So you see tons of hair coming out, way more than you've ever seen before. So in reality, it's very dramatic. This is something that it's a big change in your life, and but it really doesn't cause complete baldness. It doesn't even cause patches of baldness unless you have some other type of hair loss, which wouldn't be this. The density of the hair does go down. I mean, if you think about it, more hair cycling out, you're going to have less dense hair. The hair is going to just feel thinner, especially since the regrowing hair is much shorter than the hair that you've lost. There are some cases in which, like I said, the shedding lasts longer than 6 months. The density never quite goes back to normal in those cases either. If you're always having more shedding, then your hair is just not going to feel quite as thick. But balding still doesn't happen from it. And then one other thing is that, as you know, male and female pattern hair loss, we'll talk about in a minute, those are very common. So sometimes people will have that underlying kind of brewing underneath. And when you go through a phase of telogen effluvium, then all of a sudden you realize that you have male or female pattern hair loss also underneath. So even though we talked about different types of hair loss not turning into other types, but these are two very common types that often coexist. So what do I do when somebody comes in with telogen effluvium? Well, I look at labs. I do try to make sure that everything else is okay, because it could be a sign of a thyroid problem that's developing. Sometimes people have, thyroid disease is very common in women, and sometimes when they already come in and you're on thyroid medication, but it's not the right dose, and we catch that sometimes. We check for iron levels. Specifically, I look at the ferritin level, which is a measure of iron stores. We're looking for anemia, signs of anemia. Vitamin D. Vitamin D is also very important for normal hair cycling. That's why iron is also important, because iron is needed for normal hair cycling. And then we look at a complete blood count also, specifically looking for anemia. And then I would refer you back to your primary care doctor for particular things with the thyroid. We might supplement iron or vitamin D on our own. And then you might consider stopping or switching any medications that might be related, anything that was started within a few months of the telogen effluvium, if it's safe for you to switch medications. And usually, I just advise people to watch and wait. Does time really resolve most telogen effluvium episodes? Most treatments for hair loss, and we'll talk about in a minute, they take 3 to 6 months to take effect. And so by the time those are working, the telogen effluvium is usually resolving anyways. So I don't think it's really worth intervening. Now, if the shedding has lasted longer than 6 months, like we talked about the chronic telogen effluvium, and it's a continuous rate, then you might consider some hair growth promoters that help promote longer anagen phases and help promote growth, which we'll talk about at the end. Now, another thing that I might advise people to do is a hair count test. Now, there's a couple different ways you can do this. The most standard way would be to collect all the hairs everywhere on a day that is non-shampoo. If you do shampoo every day, then it would just be pick a day. And put everything from that day in one baggie, and then date it, and then repeat it every 2 weeks. That way you have a repeated measure. And then you look for a trend over about 2 months or so. Some people who are very motivated, they may collect all the hairs every day, count them every single day. I had somebody come in with a little Post-it, and she wrote down every single day how many hairs she was counting, and it worked for her. Some people that's too much. You can't do that. So most people, I would say, but it can be helpful. One other way is 1 minute combing of the top of the head forward before shampooing, and normal for that would be 10 to 15 hairs, and with telogen effluvium it's greater than 50. And then you can also do, like I said, daily collection of all hairs everywhere. Now, what I don't like is, some people will say collect all the hairs you see, and we'll have 10 a.m. and there's like a little bunch, and then 12 p.m. another bunch, and then after shampooing and before. And it's hard to really appreciate. You really need something that's, if it's 10 a.m. every day, then it's 10 a.m. every day, but it should just be something more consistent. It's hard. I think you might drive yourself crazy, and it's not necessarily that useful. So, all right. So another myth: my hair has been shedding for more than 6 months, though less than at the beginning. There must be something else going on. So there could be. So it's important to make sure that you have blood tests checked, like we said. If it's longer than 6 months, it might be medications that you've been on for longer than that. But most of the time, as long as the shedding has decreased, has reduced in the amount from the normal, then it's a good sign. Nobody's body really reads a textbook, and so it never really fits perfectly with these times. But it just, so some people just take longer to normalize than others. Now, it's possible, since we talked about people having different rates of shedding, that after an episode like this, your rate of shedding is just a little bit higher than it used to be, but it's still within the normal, and that's just your new normal. And then another thing is that sometimes it is hard to remember what it was like before you noticed shedding, because some people, it's hard. I think that it's important to trust yourself, but at the same time, it may be that that's how much you were shedding before, but you weren't really aware of it because you weren't too concerned. So it's hard to remember. Our memories are very untrustworthy sometimes. If there is another surge in shedding, it may indicate that there's another event. So sometimes people will have one bout of shedding because they had a stressor, and then especially people with health issues, you might undergo another stressor before that one has resolved. So then it gets a little better, but then that you had another episode that caused another episode of telogen effluvium. So you just keep that in mind as well. There's a problem because there's a bulb at the end of the hair that comes out. That's actually a good thing for it to come out from the root. That's normal, a normal telogen, and that's when the hair should be coming out. Breakage is really not a good thing, and so if there's no bulb, then it means the hair's breaking off and that there's actually damage to the hair. Once in a while we'll see that with thyroid disease, but it's not very common. And damage to the hair really comes from overstyling or overprocessing, heat and chemicals, hair dye and relaxers, even keratin treatments. One of the big culprits was the Brazilian blowout, which people are still doing, even though several years ago there was in the Los Angeles Times, there was an article about how much formaldehyde is actually in the Brazilian blowout treatments, and that it's way higher than it should be. So people still do those, and it can be quite harsh on the hair. So it's something to keep in mind. Hair dye is usually not an issue unless sometimes peroxide, so when you're lightening the hair or highlights, sometimes those can also cause some breakage. And then when we're talking about the bulb, the whole actual telogen hair, like I said, the new hair is actually it's actually the old hair is being pushed out because there's a new hair growing. So ironically, it's actually like there's the shedding is a sign of regrowth. So, all right. So then moving on to androgenetic alopecia, or male and female pattern hair loss, which is also very common. So if we break down androgenetic alopecia, we have androgen, which is a class of hormones that includes testosterone. So they're the male hormones, so to speak. Genetic, so means that it's encoded in your genes. And it's not just one gene, so it's multiple genes, which means that it may not be everyone in your family. There may be only one person in your family who has it. It may be a distant relative. And usually this one, as opposed to telogen effluvium, is characterized just by gradual thinning of the hair over time. And the process, we call it miniaturization of the hair follicle. The hair follicle literally becomes smaller and smaller. Also part of this is that there's a decreasing duration of the anagen cycle over time. So we talked about normal changes in the hair cycle as you get older. And this, because of the genetics, this definitely happens where there's the anagen cycle, the hair just doesn't grow for as long as it used to. So sometimes people do note an increase in shedding over time as well. This is estimated to affect 50% of men by age 50 and up to 90% in a lifetime, and 50% of women in their lifetime. So this is a scale that we use in my clinic by a physician, Dr. Sinclair in Australia. They took images of women at different stages of female pattern hair loss. And this shows you very clearly, this is basically normal. Could be considered normal as well for some people. But then by here, you can tell that there's really widening of the part. You can see through the scalp, but the hairline here in the front is still there, and it's just thinning over time of this hair. These are other scales. This is the one that's used mostly for men, and shows that this is not necessarily linear either. You don't always start here and go from here to here over a particular period of time. These are just patterns that we can match. And then this is a more simplified version of the pictures, the photographs that were on the previous slide. And then this also shows that sometimes women will have a male pattern like this with receding hairline. But most often they have this diffuse thinning over the crown of the scalp, the very top of the scalp. And sometimes they'll have what they call this Christmas tree pattern, where there is a little bit of loss of the hairline here. So it's frontally accentuated right at the hairline. Sometimes I see people who have more thinning on the sides than on the very top, but I think everyone's just a little bit different. So we talked about the normal hair cycle, the anagen, catagen, and telogen, and return to anagen. And so generally what's accepted is that this is progressive miniaturization, where each time you have a cycle, you go through the anagen, catagen, and then it falls out. And then the next time it grows, it's smaller. So the hair shaft, the actual hair that is growing, is finer than the previous one. And it lasts for a shorter amount of time. And then and this happens over many years then, right? Because if the anagen phase is about 6 years, by the time this happens, it's another 6 years. So that's 12 years to get to here. Now, sometimes it's faster than that. Some people do go bald very quickly, in men especially. And so they see that maybe over just one cycle, you go through this phase and then you're down to here where it's producing a very small hair. So a couple of myths here. Male pattern baldness is from my mom's side of the family. This is perpetuated even in popular media all the time. And in truth, there have been many genetic studies of male pattern and female pattern hair loss, and they show that the genes involved can come from either side of the family. And it's not just one gene. So like I said before, it's a combination of genes that you have to inherit. So then that means I can't have androgenetic alopecia because no one else in my family has it. Well, in reality, like I said, multiple genes are involved. So you may have inherited some from your mom, some from your dad, and then you got the combination that produced it. Also, it may be that you have a distant relative that you just don't know. Or you may have a relative who wears a hairpiece and you don't know. So that's true in my family, actually. So I'd say it's not necessarily it doesn't rule it out if that's the case for you. So another myth, my parents have thinning hair, but it was at a much older age than mine. So it tends to actually start earlier and earlier with each successive generation. So there are other genetic diseases where that's true too. So unfortunately, that doesn't rule it out either. And then another one is that taking hormones will help. So women a lot of times think that they can take estrogen and that will help reverse it, because the estrogen is the female hormone and it'll reverse the effects of the male hormones. So unfortunately, there isn't really consistent evidence for this. There's some cases, I think there was a transgender case where the patient was on a very high dose of estrogen, and his hair did kind of grow back a bit because of that. But it was a very high dose, and probably the risks of being on estrogen, like the heart disease risks and breast cancer and endometrial cancer, those risks probably outweigh the benefits of doing that. And then there's some hormones. People will do bioidentical hormones where women and men will actually get testosterone or progesterone, which can worsen androgenetic alopecia. So you might actually be causing more harm to it. And then there are some women who have higher levels of androgens, whether it's due to polycystic ovary disease or other problems, and that can be treated medically through the use of birth control pills or hormones or other medications. So that's probably the one case where hormones could help. So if there are other signs, like I said, then we will check hormone levels. So other signs of hormone irregularities tend to be increased facial or body hair growth, thick facial hair usually, irregular periods or spotting if you're postmenopausal. Acne is also a sign sometimes of increased androgens. Treatments in general are best at preventing worsening hair loss, so it's important to start early. It's nice if you know that you have a strong family history, because then we're more comfortable starting interventions earlier. Hair growth promoters, which we'll talk about in a moment, and medications that block androgens can both be helpful in some cases. And then genetic testing can actually be done, but they only test for the common genes that have been looked at. So you have to take that with a grain of salt. So genetic studies are generally done in particular populations, because they don't want to mix up all the genes from if you have a very diverse population. So they may be all Caucasians from Northern Europe. And then if those genes are the ones that they're testing for and you don't fall into that category, it may not be as useful for you. This is a website that lists providers who can order the test for you. We do not have the test here at UCLA. Okay, so traction alopecia early on is a non-scarring hair loss, and later it becomes scarring. And it's due to chronic tension on the hair. So it's more common, I would say, in African Americans, especially African American women who try to, from a young age, pull their hair back and make it nice and neat. But sometimes over time it will result in this hair loss here. But it happens in Caucasians as well. And it can, sometimes ballerinas who wear their hair really tight, or cheerleaders, and when they're in high school wear their hair in very tight ponytails. And then later on they'll see the effects of it. So this is definitely another one where you see the effects later as opposed to right away. And the treatment is to reduce tension as early as possible. Sometimes there are some things that can help, like topical steroids or hair growth promoters. And we'll talk about how that works too in a minute. Now we have alopecia areata, which is another non-scarring hair loss with patches, bald patches is usually how it starts. And it can become complete baldness over the entire scalp. This is what I have. And it can be complete baldness over the entire body as well. But most often it's patches like this. These are other ways that it can look. So this is a nice little circular patch here. Sometimes it goes around the edges. They call this ophiasis, which means snake-like, and it goes all the way around the back. This is more of a diffuse type of it, but you can see it's quite dramatic. And this is the total alopecia, total hair loss on the scalp, including the eyebrows. This is a close-up showing this hair, and this is even closer. These little hairs that look kind of like a little exclamation point, where it's thicker on top. It looks maybe like a little stubble too. It's almost like somebody took a shaver, a razor, and just cut everything at the same level. And those are a sign of active disease. We call them exclamation mark hairs. So what's happening? You have loss of hair and smooth bald patches. It can range from one patch to multiple to the entire scalp or body. It's autoimmune, so it means that your immune system, for whatever reason, thinks that the hair is something to fight off, kind of like an allergy. And it's also genetic. They've done some genetic studies showing that there are genes associated with it, again, multiple genes. And it affects up to about 2% of the population in their lifetime. Some point, 2% of people, at least in this country, are going to develop a patch of alopecia. The hair loss comes and goes and often recovers completely. So a lot of those people, it may be more than 2%, people just don't realize that they had a little spot and it grew back without even realizing it. A lot of times it does happen again. So you might have one, it grows back, and then it's very likely that you'll have another. It occurs at any age, actually. That's been well documented that it can happen from age 0 to 90 or 100 even. But the peak is between the ages of 20 to 40. And it's usually not associated with any other disease. But people who have alopecia areata are more likely to have seasonal allergies, eczema, and thyroid problems. So sometimes those are things that we'll check for if you come in with this. So other autoimmune diseases are also more likely to happen in people with alopecia areata, but it's still not very common. So it might be like 4% of people with alopecia areata will have this versus 1% in the general population. It's more common, but it's still not very common. So we don't always check blood work for this. It can be treated with topical steroids or injections of steroids. Rarely oral steroids, but not hormones. So hormones wouldn't work for this because it's not because of hormones. Hair growth promoters we'll talk about again in a minute. They sometimes can help. And then this is a type of hair loss that should be evaluated by a dermatologist. It's best at least to, if it's not growing back right away, to make sure that you talk to somebody who understands the process. And then sometimes when it gets very extensive and the treatments don't help, support groups can be very helpful. And there's a patient advocacy group specifically for people with alopecia areata, which is right here. And I'll list all those groups again at the end. Okay, so then we're going to switch gears and talk about scarring alopecias. Cicatricial is another word for scarring. It's a much less common type of hair loss. But the problem here is that when it scars, remember that hair follicle gets destroyed, so it can't produce another hair shaft. It can't grow hair anymore. So some people like to refer to this as a hair emergency because the hair is being lost and destroyed, so we want to try to stop that. Generally, these people who have this will have some itching or pain on the scalp. Sometimes you'll get little pimples or red rashes also associated with it. So these tend to be more symptomatic. The non-scarring alopecias usually are not very symptomatic. Sometimes there's itching or pain, but usually not as much. And usually you don't see anything on the skin. So because there's inflammation associated with these types of hair loss, we can use things like steroids, or corticosteroids, which reduce inflammation, and we can use antibiotics, which also reduce inflammation. And these are the ones that I'm going to talk about today, and we'll talk about the names in a minute too. So central centrifugal cicatricial alopecia, which is a mouthful, or CCCA, is basically very descriptive. It's actually centrally located, usually starts on top of the scalp, and it usually starts small and it spreads outward, so that means centrifugal, and cicatricial meaning it scars as it goes, and alopecia meaning hair loss. So it's a nice name, but just a mouthful. It's actually very common, and mostly in women of African descent. It can happen in men as well, and sometimes in other ethnicities, but it's most common in those of African descent. It may be related to hair care practices. So in the past, it was called hot comb alopecia. I think there really is hot comb alopecia where people literally got burned on the top of their scalp when they used hot combs. But it's not always related so directly. Relaxers also can be quite damaging to the hair and may make this worse. A lot of times we also see this in conjunction with traction alopecia, so people will have hair loss here on top, but also around the edges. But it does seem like it's something more than just those hair care practices, because there are people who, believe it or not, have not done anything at all to their hair and they still have it. So there's likely a genetic component to some degree. And so some people, we don't completely understand what the process is. My thinking is that this is something where the hair, because African American hair tends to be more fragile and curly, that over time it kind of irritates the skin around it and can cause inflammation around the skin and eventually causing hair loss. So I think that's the tendency there. This is another type of scarring alopecia called lichen planopilaris. It's an inflammatory scarring alopecia. A lot of times this happens in patches too. So sometimes people will think that they're looking at alopecia areata because it's in patches. But then if you look a little closer, you might see lots of little, kind of like little spicules around the hair follicles, little scaliness, and they're little circular things right around the hair follicles themselves. So it's not just a rash all over. And then if you look even closer, like right here, there's no hair follicles. It looks like it's very, very smooth, like a scar. And this is one person who had more scarring, a little bit of redness as well. And this often comes with itching and or pain, kind of a tingling sensation maybe. So it can be quite uncomfortable in addition to losing the hair. Frontal fibrosing alopecia is is considered a variant of lichen planopilaris, or LPP. And this also is kind of descriptive in terms of its name. It happens along the frontal hairline, and fibrosing meaning scarring. And basically, it's more common in postmenopausal women, although we see this sometimes in men, sometimes in young men and young women. And slowly but surely, the hairline just kind of creeps back over time. And this can be very insidious. It can be very subtle at first. And then all of a sudden, you realize that your hairline is very far back and that it just doesn't look quite normal. So a lot of these women think that they have male pattern hair loss or female pattern hair loss. And it's not until they go to try to get a transplant that the doctor says, no, I think you have something different. Or they just decide to come in to get an evaluation and we say, no, you have something a little bit different. Sometimes the eyebrows and eyelashes and body hair also get lost. And that's a curious thing that happens. If they biopsy those areas, it looks the same as the scalp. So if they take a little sample of the skin, it actually looks exactly like what's happening on the scalp. This one, usually there's less itching and pain involved, but sometimes there is some. But even though it's thought to be related to lichen planopilaris, that's because under the microscope, if we take that sample of skin, it looks the same. But sometimes the symptoms are a little bit different. Now, discoid lupus is something that I don't know if people have heard of lupus, systemic lupus, which is an autoimmune disease that can affect a lot of different parts of the body. Discoid lupus is the type that just affects the skin. It can occur in conjunction with systemic lupus, but having the discoid lupus doesn't mean that you do have systemic lupus. So a lot of times it's very common on the scalp, can also be on the face. The ears are kind of a common place for it. And usually you see more of a rash. So unlike the previous ones where you saw just the little dots around the hair follicles, you see more of a rash, kind of a confluent plaque that gets a little scaly and red, and usually is itchy or painful as well. This is less common, something called folliculitis decalvans. A lot of times you see pimples that are itchy and then result in patchy alopecia. So you'll see, depending on when they come in, you might see pimples, you might see just a bald patch, patches in different areas. Sometimes they scar with thicker scars too. So, and this tends to, like I said, tends to be itchy more than painful. Now this one is called dissecting cellulitis of the scalp, and this tends to be very painful. These are nodules and cysts, kind of like very, very bad acne that happens on the scalp. And the real hallmark of this is how much it hurts. People have bad headaches. This usually happens more in younger men and men who are of African descent or Hispanic, Latino descent as well. Okay, so I just wanted to give you guys a little bit of a taste for the spectrum of hair loss disorders, and not necessarily to scare you, because some of those last photographs I know are a little bit extreme, but to just show the spectrum. Okay, now we'll talk about treatments of hair loss, and I kind of put these into a couple of different categories. I decided to do hair growth promoters, hormonal treatments, and then anti-inflammatory medications. And so hair growth promoters, they really kind of non-specifically just help the hair grow better. And this might be by making the anagen phase, the growth phase, longer. It might be for whatever reason. A lot of times we don't really fully understand why they work or how they work, but they do. So they can work for just about any type of hair loss. If you have scarring alopecia, you might not be able to regrow hair from those areas, but it'll help the hair around it grow better. And then sometimes when they first get started, they will start a telogen effluvium of their own. So that's why some people will talk about Rogaine, which falls into this category. And it causes a little bit of shedding when you first start using it because it's taking over with the hair cycle. And they all take about 4 to 6 months to work. The hormonal treatments, really we're talking about only for androgenetic alopecia. And then anti-inflammatory medications only work for inflammatory types of hair loss. So like those scarring hair losses, they can help stop the process. For alopecia areata, they can help, but not for things like telogen effluvium or androgenetic alopecia, which have to do with the hair cycling and genetics. So the first step whenever I evaluate somebody or talk about treatment is scalp health. So I talked about that briefly earlier, but we're going to talk about it more now. So scalp health is very important because if you think about it, it's like if you have a garden, you want the soil to be the right thickness, right? There's all sorts of things with gardening. And so the same thing with your hair. You want the skin where the hair is growing from to be healthy and to be optimized. So things like itching, dandruff, and oiliness can all prevent good hair growth. And there's zinc pyrithione shampoo, which is the main ingredient in Head and Shoulders, although it's found in a lot of other brands as well. It actually has been shown to be helpful for thinning hair, probably because it improves the scalp health and then improves the hair growth from there. There's also something called ketoconazole shampoo. It's available over the counter at 1% strength and prescription 2% strength. It's been shown to help hair growth almost as much as Minoxidil or Rogaine, 2% solution. And it's probably for the same reason, because it improves the scalp health so much that the hair grows better. So there's a lot of talk about sulfate-free shampoos these days. And people will switch to sulfate-free shampoo sometimes if their hair is not growing well. And in reality, sodium lauryl sulfate, that's a common sulfate that's in these shampoos that is, marked as very harsh. It actually cleans the scalp very well. It's a detergent, and that's why it's in shampoos and soaps and things like that. So it can be harsh on the hair. So sometimes if you have breakage of the hair or you feel like your hair is very brittle, it might be better to avoid sodium lauryl sulfate. But if you have an oily scalp, you get dandruff or anything like that, you might want to stick with one that has sulfates in it. Another one, dandruff means I have a dry scalp. So dandruff is usually actually a sign of an oily scalp. The scalp, the oils build up, it gets a little bit irritated, and the dead skin flakes off. That's what the dandruff is. It's the dead skin flaking off. So most of the time, it's not that your skin is too dry, but rather that it needs to be cleaned a little bit more. And then the same concept about the anti-dandruff shampoos as in terms of the sulfate shampoos is that the anti-dandruff shampoos often dry the hair out because they're cleaning the scalp so well. They're getting rid of the oils. But conditioner can be used to help restore some of the oils to the hair without necessarily putting it on the scalp. Let me think if there's something else I wanted to say there. No, I don't think so. Okay, so then once the scalp is healthy, then we can move on to other treatments like hair growth promoters. And the other reason that is important to have a healthy scalp is that most of these hair growth promoters, at least the top two, are directly going on the scalp. And so if you put something else on the scalp that's already unhealthy, it might not absorb it as well, it just might not work as well. It might also cause more irritation. So we got to get that scalp healthy. So the most commonly known is topical minoxidil or Rogaine, and this is also has the best evidence. It's been studied for many years, has been studied in many people, and has been shown to be effective at improving hair growth. Specifically, it's been studied in male and female pattern hair loss. So that's what it's FDA approved for. But like I said before, it's fairly nonspecific and it's not hormonal in its effect, so it can be used for just about any type of hair loss. There's something called the laser comb or helmet, which uses low-level light therapy. It's actually just red light that's focused into a laser type of light, and we'll talk about that in a minute. There's a marine extract supplement called Viviscal, which I think also is very promising. Then there's other vitamins like biotin. So these are the different forms of Rogaine. And this is just to show you that minoxidil, which is the main ingredient, also does come in other brands and other types. So this is from Costco, the Kirkland brand. But basically, there's the women's solution, which is 2%. There's the men's solution, which is 5% and stronger. And then there's the men's and women's foams, which are actually identical. They're the same. They're both 5%. And it's just marketing that the women's foam is marketed this way. However, the nice thing is that this women's foam, it used to be that the foam was only approved by the FDA for use in men, but now it is approved by the FDA for use in women as well. It was shown to be safe and efficacious. So that's the nice thing about that. These two, the men's will say not for use in women, but they're perfectly safe to use in women. The reason why the women's solution doesn't come in 5% is just that because of the side effects, that the men's solution, the 5%, was shown to cause increased facial hair growth, much more so than the women's solution, which also does cause increased facial hair growth in some people, but it's more likely to happen in that 5% solution. So there's a lot of myths surrounding minoxidil and Rogaine because it's well advertised, it's been around for a long time. A lot of people have a lot to say about it and a lot to think about it. So one is I tried Rogaine and it didn't work. Well, it depends how long you tried it. So if you tried it for 1 month and it didn't do anything, well, it was not supposed to do anything in 1 month. It takes about 6 months to see an effect. On the label, I think it says 4 to 6 months. Give it a good 6 months. And then the other thing is sometimes you can't see the effect because it keeps the hair loss from getting worse instead of growing hair. So you might not see any growth of hair, but that doesn't mean it's not working. Another myth, you have to use Rogaine forever or it will make your hair loss worse. So you do have to use it forever in order for it to work forever. If you want to maintain what you're getting, the benefit that you're getting from it, you have to keep using it. But what's happening there is that the underlying hair loss will progressively get worse in male and female pattern hair loss, no matter what you do. And if you have that problem, then when you stop the minoxidil, you're going to go back to where you would be otherwise. So the hair loss doesn't get any worse than it would have been, but it's worse than where you started because in 5 years it's going to be worse than where you started anyways. If your underlying hair loss will get better even if you don't treat it, like telogen effluvium, then most likely when you stop the minoxidil, it won't be any worse. You might get a little bit increased shedding when you stop it because of those cycles that we talked about, but the hair overall, at the end of the day, the hair loss isn't going to be any worse than it would be otherwise. So it's not Rogaine's fault, put it that way. Okay, so laser comb or helmet. So the laser comb that's made by HairMax, this company, HairMax, has the best evidence to support its use. There was a big study done last year, or probably the years before, but it was published last year, that showed that it was effective for people with thinning hair. It helps reduce the amount of shedding, or it helps reduce the overall loss of hair, and it may increase the amount of hair that you have. Laser helmets, which use the same type of technology, may be helpful, but they're not studied as well in that sense. And some people think, HairMax will say, because it's this brush, that it has these teeth that kind of part the hair a little bit more, so it gets to the scalp better than a helmet, which is really just sitting on top of the hair altogether. But then some people like the helmet because of its convenience. There are sites where you can go, some doctor's offices, where they have helmets or machines that are like this, where you can go a couple times a week to get the treatments. But this is nice and convenient. If you get it at home, then you can just sit and read the newspaper like this gentleman. This is nice because it's very safe, and it's usually just 3 times a week for about 10 minutes or so. So that's a nice option for people who don't want to be taking too many chemicals or medications and things like that. Now, Viviscal is that supplement we talked about. It's a marine extract, which is proprietary, so we don't know exactly what's in it. They do know that there is some shark cartilage in it, which is a problem for some people, but they say that on their website that it's all it's done in a safe way, so they're not doing anything to endanger sharks. Some dermatologist offices may sell a professional version. I'm not sure how different that is from the extra strength version that you can purchase online. We do not sell it in our office at UCLA. Other vitamins and supplements. So there's unfortunately very little evidence to support their use in any type of hair loss. Biotin is well known as something that might help with hair loss, but most people who try it say if they have any benefit at all, it helps their hair grow faster, but not necessarily thicker. But there is evidence that it helps with nails. Zinc, so like I said before, zinc pyrithione, the shampoo, has been shown to be helpful, but supplementing zinc is not necessarily going to be helpful. If your zinc level is very low, of course, probably supplementing it would be good. Saw palmetto is a supplement that's available over the counter. It actually is a hormonal supplement, so it works very similarly to some of the other hormonal treatments in blocking the effects of male hormones. So I'd say you have to be careful with that one because it can have all those side effects as well of blocking hormones. So iron and vitamin D, we talked about earlier, they're required for normal hair cycling, so those are things that we should make sure are normal. High doses of vitamin A can cause hair loss. So some people will bring in these hair and nail vitamins that are specifically for hair and nails, and I'm horrified to see that it has like 200% of your daily allotment of vitamin A. That's not what you should be taking. You should be trying to make sure that you're not taking too much vitamin A. And then topical melatonin is something that's been shown to help hair growth. It's not really clear that melatonin supplements by mouth, which a lot of people do for sleep these days. It's not clear that that helps with hair growth, but the topical versions, which I'm not sure are available everywhere. have been shown maybe to help. And then, okay, so then we're going to talk about hormonal treatments now. Prescriptions. Finasteride is FDA approved for use in men with androgenetic alopecia. Propecia is the trade name of it. Proscar is the same medication that's used for benign prostatic hypertrophy or hyperplasia when the prostate gland is large in men, and it reduces the size of the prostate. Now, it mostly prevents worsening of the hair loss, just like Rogaine, but sometimes it does improve regrowth, and it probably works better than Rogaine does. In combination with Rogaine, it's been shown to be very effective. It does take several months to work, just like Rogaine does, and its effect is also not maintained if you stop it, just like Rogaine. So, like I said, it's not the medication's fault, it's because of the underlying problem. Now, in women, higher doses have been suggested to be useful, but the low dose, the 1 milligram, was not shown to be helpful at all. And then also the problem with women using it is that we don't have any information at all whether it's safe or not to use. So it probably is safe. Theoretically speaking, when you're blocking some of the hormones, you could always cause other problems hormonally, including things like breast cancer and endometrial cancer. So sometimes we worry about that, but again, we don't have any evidence either way for that. Spironolactone is a medication that I do use in a lot of women with androgenetic alopecia or female pattern hair loss. The doses range from 25 to 200 milligrams a day, and it's pretty good. About 3/4 of women, or sometimes even more, have been shown to have slowing of hair loss or regrowth of hair. I find that this tends to work better in younger women, especially those who might have irregular periods or polycystic ovary syndrome, other signs of problems with their hormones, things like acne. This actually will help your scalp get healthier as well. So if you have oily scalp, this usually helps for that problem as well. So it's something that we also do worry about. It's a diuretic. It makes you go to the bathroom more often. Normally it's used for heart disease or blood pressure. Sometimes it's used as a diuretic to make people lose more fluid. It can cause irregular periods because it's blocking hormones. Sometimes we'll give it in conjunction with birth control pills because it will make sure that those periods are normal. It's not safe in pregnancy, so if you give it to young women, you want to make sure they don't get pregnant. And there is a black box warning on it from the FDA because when they gave it to mice in very large amounts, they had different types of cancer, including breast cancer. Now, they looked at that data, or they've looked at it in women as well, and postmenopausal women who have a higher rate of breast cancer anyways. And this was a very large study done out of England. And they found that there was no increased risk for breast cancer in those women. So it's probably not a real risk, but it's still on that label. So it is something to be a little bit concerned about. Okay, and then we're going to talk about anti-inflammatory medications. These kind of get categorized into corticosteroids, antibiotics, and immunosuppressants. And the corticosteroids are the mainstay of any basically dermatologic practice in general. We use topical versions, injections, and pills. We use this for alopecia areata as well as scarring alopecias. And we also use it for seborrheic dermatitis, which is the bad dandruff that we talked about, to improve scalp health. So sometimes we'll use it in other conditions too where we need to get the scalp healthier. This is sometimes people come in requesting injections for their hair loss, and I think it's because they know that people with alopecia areata often get injections and have their hair grow back. But it only works if you have inflammation that can be treated by the injections. So antibiotics, topical and oral antibiotics, and these we use mostly for scarring alopecias, and not all of them, just for some of them. And the idea is that sometimes there is a little bit of infection, and sometimes it's just they work to be anti-inflammatory. And then immunosuppressants. There are some topical versions that are not steroids. And then mostly these are oral medications that have a lot of side effects. These are medicines that are often used for people who have transplants, organ transplants, to suppress their immune system so they don't reject the transplant. We'll use them at lower doses for their anti-inflammatory effects. But then of course, they still carry a lot of potential side effects. And these we use for alopecia areata and scarring alopecias. And then there's hair transplant surgery. This is used for androgenetic alopecia mostly. Sometimes we use it for end-stage scarring alopecia. So scarring alopecias that are not getting worse. They've stopped getting worse. You've stopped losing your hair. There's no more redness, itching, pain, or pimples. And you just have a spot where there's no hair. So sometimes the transplant will work for that. It doesn't work for telogen effluvium, alopecia areata, or active scarring alopecia because the hair follicle is still there, or in the scarring alopecia, it's still inflammatory. You're going to just lose the transplants that you put in. So what do? They take hairs from normal scalp, which in androgenetic alopecia is usually the back of the scalp, and they usually take a strip, and then they cut them all up into these little groups of hairs, 1 to 4 hairs, and then they stick them in the front. So it's just literally taking it from the back and sticking them in the front. And for whatever reason, the hairs remember where they came from. So they grow as if they're growing in the back of the scalp, so they grow nice and thick. Usually in androgenetic alopecia, they do say it's going to work best if you use Rogaine, Propecia, or spironolactone, because you're still, if you can keep whatever you can naturally, then and medically, then it's going to work a little bit better and give you a better hairline. In the past, they used to do plugs where they took a bunch of hairs and stuck them in the front, and it looked very unnatural. These days, they are very good at making a natural hairline. And then, of course, camouflage hairpieces and wigs can be very helpful in all of this. There are a lot of different brands for camouflage. There's powders and sprays. This is kind of like a powder makeup type of thing. If you're going to do extensions, just be careful that they don't add tension to the hair. Maybe move them around. Make sure that they're being gently placed so that you don't cause a secondary problem. And wigs, clips, any hair bands can cause further damage to the hair. But again, sometimes the clips can be moved around, so you're not always putting it in exactly the same spot, so you have hair loss in that same spot. Okay. And then there's so many other treatments out there. There are a lot of different things that people advertise that they help the hair grow better. Shampoos, supplements. Some of them might work, but we just don't have enough information. A lot of times those products have Rogaine in them, have Minoxidil in them. And so it may be that they do work because they have Minoxidil, but it's the same as just getting Minoxidil. So thickening shampoos in general improve the appearance of thin hair, but don't necessarily have anything in particular that makes the hair grow better. But they just make each hair strand look thicker. And then there's something called platelet-rich plasma that has been kind of in and out of the news. I'm not sure how much great evidence there is for it. There are doctors who do it. They draw blood from you, they spin it down, and then they take the plasma part of it with a lot of platelets, and they inject it back to the scalp. And the thought is that in your own blood, that there's a lot of growth factors that will stimulate hair growth. They use this technology also for people with knee issues and cartilage issues. So it's not just used for hair. It may or may not work. It's not considered mainstream in medical care at this point. So, and then support groups. So there's I talked about the National Alopecia Areata Foundation, is a patient advocacy group, and there's a Cicatricial Alopecia Research Foundation for all the people with different types of scarring hair loss as well. And then, as always, I do run a support group for this, for alopecia areata, and a lot of times we have people with other types of hair loss, and a lot of times the same issues arise, so people are always welcome to join those support groups. There are a lot of resources online as well for support, a lot of blogs, which you have to be careful about because you don't know what, you're not sure what you can trust other people saying. But sometimes it's helpful for support. So in summary, there's a wide range of normal hair and what we can say is normal. Hair loss problems generally can be divided into scarring or non-scarring, hormonal or non-hormonal, and non-inflammatory and inflammatory, if just different ways to categorize these. And treatments should target these subtypes. So it's important to realize that there is this dichotomy in there that for treatment, some things are just not going to work. In general, treatments are limited in their efficacy. So we're not claiming to be able to, bring any miracles for anybody, but they are available. There are things that can be done for people, and it's just they may not be dramatic. And then just be careful with claims made to improve hair growth from any different products. You don't want to. At some point, it's okay to try different things, and it's probably safe to try a lot of different things, but they all come at a cost, and mostly, so you want to watch your wallet and not feel desperate enough to go and buy everything that's out there that claims to improve your hair. So that's it. I have some questions.
But it's okay, you're saying?
Yes, it's okay to use. So the question was 2% versus 5% for the minoxidil. That the labels say not to use the 5% in women. Like I said, the foam for women is 5%. So it's okay to use.
But only the foam.
Only the foam. The solution is okay to use as well. It's just, so the men's solution tends to be greasier. It tends to cause more itching and irritation of the scalp, and it causes facial hair growth more often than the women's solution.
Thank you.
All those things can happen with the women's solution as well.
Should I put in a liquid that you can apply?
Okay, so the question is whether spironolactone comes in a liquid that you can apply, and no. The answer is no, unfortunately. Okay, so.
I noticed that. Is this PowerPoint going to be posted as well as?
I believe so. Ishara? Not sure. Yes? Usually? I'm not sure, but I think so. I believe so.
And what is that site?
I don't know that information.
First of all, for just normal hair, how often should hair be washed? Not extra oily or anything. And how can I find shampoo that doesn't have sodium or sulfate in it? Everything I've looked at that I have.
Okay. So the questions were how often should normal hair be washed and how to find a sulfate-free shampoo. So the first question is, it kind of depends. I mean, I'd say on average maybe every other day or every third day is good on average, but some people, they wash their hair once a week or every 2 weeks and their scalp is fine. So it really varies a lot what should be normal. And then other people, every day is fine for them. So, and in terms of sulfate-free shampoos, there's a lot of them out there that don't have sodium lauryl sulfate. Aveeno has a good sulfate-free shampoo. There's a product line called Vanny Cream or Free and Clear, which is available at Walgreens or online. And those are sulfate-free. And then I think a lot of other lines do carry them if you just go to the pharmacy to check.
How damaging is spray or blow dry ironing?
Okay. So the question, you mean hairspray? Is that okay? Or blow drying heat. So the question is regarding how damaging hairspray, blow drying, or other heat like a curling iron or flat iron are actually to the hair. It depends. I think it depends how high heat you use. So if you're blow drying every day at very high heat, you're more likely to cause some breakage of your hair. Flat ironing, the same thing, and curling irons. Curling irons, I don't think people usually hold their hair in a curling iron that long, but flat ironing, when they straighten their hair, they tend to hold it there for much longer and at higher heat. So hairspray itself really shouldn't be damaging to the hair. So my clinics are, actually have clinic every day of the week, but the hair clinic specifically is twice a week. One is in Santa Monica at 20th Street, and one is on Westwood in the 200 building. 20th and Santa Monica Boulevard, 2020, yeah.
What do you do at the hair?
Sorry. The question is, what do I do at the hair clinic? So the hair clinic is for people with hair problems. They come in, we have a 15-minute appointment, and we talk. You ask me about your hair loss issues, and we evaluate it, and we'll talk about treatment options.
So how do you find out
Um,
how to make it?
so that is available. I'm on the UCLA website. If you look for physicians and the dermatology website, I'm on there. There's phone numbers. Sorry.
I have two quick questions. Number one, when you talk about the sample, you mentioned that there's a shampoo with 1% and 2%, and 1% can be purchased over the counter. What is that one called?
So it's ketoconazole. The brand name is Nizoral. Nizoral.
Okay, and then the second question is acupuncture?
So the question, sorry, just to repeat the question. So the first question was about the shampoos, the 1% and 2%. And then the second question is about acupuncture. And I don't know if acupuncture is helpful or not. I'm not sure anybody can say for sure whether acupuncture would be helpful. So.
I've been told all my life that a dry, sticky scalp means the blood is not rushing to your scalp properly. My mother used to have me hanging my head down.
Okay.
Is there any truth in any of that? The hair loss could originate from that?
I don't think so. However, Rogaine, one of the ways that Rogaine and Minoxidil works is by opening the blood vessels a little bit more. So maybe there's a little bit of truth to that, but it's probably more complicated than that.
Massaging the scalp, does that help to stimulate hair growth?
The question is about scalp massaging to stimulate hair growth. I don't think there's much evidence for that, but it probably feels good.
Yes, I was wondering, this is a brief question, by the way, if for bristle brush, hair coverings of any sort, scarves, pants, are they problematic? And also, the products you mentioned hadn't told us were there any other products that are uses to make your hair.
So let me just paraphrase. So the question is about whether hair coverings like hats and scarves can be damaging to the hair, boar bristle brushes, and if there are any other products other than what I've mentioned. So the hats and scarves really shouldn't cause any problems. There is something called like pressure-induced alopecia, but that's usually people who are in the hospital for a long time, or babies. You see that where they are always lying on their back of the head and they have a bald spot there. So if something like that is causing enough pressure on your scalp, you could get some hair loss theoretically, but it's not likely. So usually that's not a problem. The boar bristle brushes, they may be too harsh or too tangly, so a gentle comb is probably better. And then the third question about other products, there's so many other products out there. The ones that I highlighted here are the ones that I think have the best evidence behind them. So.
The boar bristle brush is not positive or different?
Not necessarily.
Yeah. Thank you. You see a lot of hair loss and thinning in older elderly men and women. Is this due to a hormonal depletion? And
then if one takes hormone replacement therapy, is that good? Is it counterproductive because you relate it to hormones?
So it depends on, so there's different types of hormones. So the question was about seeing a lot of elderly men and women with hair loss and hair thinning. And
Particularly here.
yeah, particularly on top. Most of the time it's male or female pattern hair loss. So it does have to do with kind of a relative excess of male hormones, of androgens. So in women, well, in women specifically, when you're postmenopausal, your estrogen goes down, and so relatively speaking, you have more male hormones circulating. And so that's why a lot of times we do see a surge of thinning in postmenopausal women. However, replacing the estrogen does not always work very consistently. So
What if you're adding testosterone and progesterone, which you have said that can increase hair loss?
Right.
Is
So-
it then not going to be a good thing? Or?
right, so adding testosterone is rarely a good thing when it comes to hair loss. We see this in men who are low testosterone and they replace the testosterone and then they end up having increased hair loss. In women, if you give them testosterone, even if you're low, it can increase your hair loss.
So hormone replacement therapy is likely to cause hair loss in women?
No, that's not what I'm
Because
saying.
you're increasing, well, actually you want to find a good normal level, but you said that testosterone and progesterone can cause the hair loss.
Can increase hair loss, but most hormone replacement therapy doesn't include testosterone or progesterone.
But it does sometimes if a woman's
Right.
testosterone level is too low. Because
Sometimes,
testosterone
right,
is
right.
important.
Right. It can be, so. Right there, yeah, that's you.
This might not be for you, but I have a 31-year-old daughter who has been bleaching her hair for years. And it gets shorter and shorter, and she has extensions. And now she's pregnant. So there's been things about don't get your hair bleached. And you mentioned that extensions, if not applied right, could apply pressure, and that could cause further damage.
Yes, that's true. So the question is,
Stop bleaching if you're pregnant. Get rid of extensions.
yes, stop bleaching if you're pregnant, and extensions probably are worsening hair loss and breakage of the hair.
Thank you.
With Rogaine on the bottle, it says to only apply it on the back of your head, and that Rogaine is only effective for the back of your head and not the front. And also, in addition to that question, just a second question, to my understanding is that with male pattern baldness, you said that that's non-scarring. So the areas that appear to be thinning or appear to be bald can regrow with hair. Is that what that means?
Theoretically speaking, yes.
Okay.
So the first part of the question was about Rogaine and the application of it, where it's most effective. And the second question was about the scarring, the non-scarring nature of male pattern hair loss, that the hair could grow back. So the easy one, for the second one, yes, theoretically the hair could grow back. But the caveat there is that a lot of times it doesn't. It's different. But technically speaking, the hair follicle is still there, and the stem cells are still there. The first question is a good one about the Rogaine, where to use it. It says on the package to use it just on the top of the scalp because that's where they studied it. So they studied it in a localized area. When you do a research study, it's easier to study a very localized area. So that's the only place they can advertise that it works. They can't say that it works anywhere else. My feeling is that it probably doesn't work quite as well along the hairline. So like if you have a receding hairline, it doesn't necessarily work as well, but it can work there. So.
Hi. If somebody, I have a relative and they're just turning 60 this year, and they have like natural blonde shoulder length hair. She says she's lost 80% of her thickness. Each strand is so fragile it hardly grows out. It's extremely thin and frail. Some grow out only a few inches from her scalp. She's had Graves' disease for 20 years. And when she had that, she had her thyroid radiated out, so she takes the pill every day. There's hardly enough hair to hold a wig in place. The paternal grandmother wore a wig since her hair had become very fine and had thyroid problems. One, that's my older sister, so do I need to worry about anything? And two, she'd like to know answers to all this. What would be the best idea for her?
So, okay, so the question has to do with your older sister, is that right? Okay. And thinning hair and just relationship to thyroid disease and what your risk is. So I can't say I can't really give you a great percentage in terms of your risk. You may be at higher risk of having hair thinning as you get older because of that, but it just depends. And then in terms of what she can do, so wigs don't need necessarily hair to stay in place. A lot of times they're wigs that just sit on top, and you can tighten them around the sides, or and you can clip them in if you want to, but you don't have to clip them in. So so that's so hair piece would be fine. And then in terms of other things, that would be a consultation. So.
And were you saying that because of the thyroid, that's the disease for a long time, that's why it's happening? Or does she have one of those certain things you were saying?
So the question is just what's going on. I don't know. So thyroid disease is kind of tricky because once it's corrected, usually the hair should get better. However, it sometimes doesn't, and there's probably just differences in the thyroid that's replaced versus normal thyroid. So I'm sure that has some component to it, but it sounds like there's some family history as well. A little bit of like female pattern hair loss or androgenetic alopecia probably as well. So over here. So the question is about the FDA approval for other treatments like the laser comb and spironolactone. So laser comb is FDA approved as a safe device. It's not FDA approved for female pattern hair loss or hair loss of any kind. So that means that when they did the study, they just had to show that it was a safe thing to use, but they didn't have to show that it was efficacious. Now, spironolactone is FDA approved for use for other things, but not for hair loss. So it also does not have as much research behind it as Minoxidil or Propecia.
Another question I have is minoxidil efficacy age dependent? Like, for example, if it is used in younger people, that works better than older people?
So another question about whether or not minoxidil is more effective in younger people than older people. Not necessarily. It's just that it works best at keeping the hair loss from getting worse. So more likely if you're younger, you have more hair to save than when you're older. But that's just a likelihood thing. So it's not necessarily safer or better.
In the minoxidil, is it a uniform growth or is it just blotchy, patchy growth?
So minoxidil is a uniform growth or blotchy or patchy growth. It's usually uniform. It probably depends on how you apply it. But if you apply it kind of pretty much all over your scalp, then you're probably going to have it more uniform. But nobody's perfectly symmetric. Nothing works completely, so it may be that it grows better on the top of your scalp than the sides or vice versa, but it's more or less uniform. In the back?
A healthy scalp is, if you're having itching, dandruff, and all that, it's a sign of an unhealthy scalp. Yet the Rogaine use causes itching, so it seems like a double-edged sword.
So Rogaine use can cause itching. It doesn't always cause itching. So it's true. If it causes itching, then you probably shouldn't use it because number one, you're uncomfortable. Number two, it's promoting an unhealthy scalp. But there are ways to deal with that. So one is you just don't use it and the irritation goes away and then you just try one of the other treatments. Another way is sometimes topical steroids will combat that irritation and allow it to be tolerable and useful. But you're right in general about the itchy scalp.
What did you say about finasteride and the doses?
for men versus women? And can that increase testosterone or male hormones?
So finasteride works by blocking the conversion of testosterone to DHT or dihydrotestosterone, which is a stronger form of testosterone. So in men, the approved dose is 1 milligram a day. And women, 1 milligram a day, and postmenopausal women was shown to be ineffective. There are other cases and reports of 2.5 milligrams or 5 milligrams being effective in women, yeah. But it's not been well studied, so it's not clear what the optimal dose is. And then because it blocks that conversion, you can have more testosterone because it's blocking testosterone from going to DHT. So you have more testosterone, but you have less of the more potent DHT. So that's generally how it works.
I wear a CPAP mask and it has straps that cause tension. Can that cause damage?
If it's pressure, consistent pressure in the same spot, it could, theoretically.
I want to clarify steroid injection would be a treatment for female hair loss.
Right. So steroid injections are not a treatment for female pattern hair loss because female pattern hair loss is hormonal and not inflammatory.
Regarding surgeries that can cause hair loss, is it due to stress or the anesthesia or a combination of factors?
So it's usually thought to be, I think it's the stress. Some people say it's the general anesthesia. I'm not sure anyone knows for sure.
Okay, everything that was said up there, there's very much to have together. This shampoo that we use doesn't work. I know several
Which ones?
that used it.
Which shampoo? Which shampoo?
So Rogaine.
Rogaine? It's not a shampoo. So, okay.
Yeah. Yes, it was too hard.
Yes, I know what you mean.
And you took my hair out, so it's not.
So,
do you have a thing for,
okay. Yeah. So the question is about applicability of these recommendations for African Americans and African American hair. So yes, the problem with Rogaine is that it only comes in that solution or foam, which is also liquidy, and they can they really dry out the African American hair and other hair that's like that. And so a couple options. I had somebody find a version of Minoxidil that comes in an oil on Amazon. So if you look on Amazon.com and you can look, if you don't have a computer, or you have somebody who can do it for you. So Minoxidil is the main ingredient in Rogaine. And you can look for Minoxidil in oil. And it may not work as well as it does in the liquid solution, but it has that ingredient in there. So Minoxidil in oil might be more helpful for you. Yeah, so I see lots of African Americans in that clinic as well, and we will focus it's Santa Monica and Westwood. If you look at, and again, with the UCLA, through how you found this, perhaps talk to Ishara about how to get in touch, to call the referral line. I do not take Kaiser. Yeah, just UCLA though. So the question is whether oil will help for itchy, dry skin on the scalp. Sometimes, yes, and sometimes it's like even just olive oil. I had somebody come in with garlic scented olive oil once, but so try to avoid that just because the smell. But regular olive oil, coconut oil, a lot of those things that are out there, they can really help with the brittleness of the hair if it feels like that. Sometimes with the scalp, mineral oil can help break up some of the flaking too. But you want to be careful, again, if it's too much oils that are making your scalp flaky and itchy, then you might not want to add more.
The clinic that you're talking about, in order for my grandson, who's 22 and seems to be developing a definite male pattern, he's not that concerned about it, but I am. Anyway, would it be a consultation or just a clinic visit? And if so, your clinic, how would you go about arranging it?
So there's appointments. It's just a regular like doctor's office. So it would be just call the number, the UCLA referral line, or find it online and call and make an appointment, and we'll spend the time that.
Differentiate between a clinic and a consultation.
Oh no, it's the same thing. That's what it is.
Hi, I have a question about a shampoo I just bought, Minoxidil. Does that help at all? I just bought it.
So the question is about Nioxin shampoo, which is a well-known brand and that it has been around for a long time. So in general, a lot of people like it. Some people don't. I don't think it has that much evidence behind it to be helpful, but again, it's not harmful, except that it's a little expensive.
And the second part, you mentioned that sulfates in the shampoo does not cause hair loss, but the other, you mentioned another form of sulfates does, which is not really You said sulfates in itself doesn't cause hair loss.
No, yeah, I think so. What I meant to say, the question is about sulfates in shampoos, and no, usually the sulfate that people are worried about is sodium lauryl sulfate. That's the one that's common in a lot of things. There's other types of sulfates that are in shampoos as well, but usually it's sodium lauryl sulfate, and it can cause drying of the hair, but it doesn't really cause hair loss on its own. So, and might actually help your scalp. Yeah.
If you have a vitamin C deficiency and what appears to be female pattern hair does, if you get vitamin D back to normal, will that help female pattern also?
So the question is about vitamin D and female pattern hair loss. And so vitamin D deficiency, there's no clear link between vitamin D deficiency and female pattern hair loss or any of the ones that I've talked about here. There are some types of vitamin D deficiency that are related to other types of hair loss. So theoretically speaking, it could improve your hair growth, but I wouldn't say necessarily that improving your vitamin D level will help your female pattern hair loss. Okay. Yeah.
Well, my question is about if there's a difference between treatment and diagnosis of hair loss that begins in the 20s versus, say, postmenopausal or older hair loss.
So the question is about whether there's a difference in treatment and evaluation of hair loss that occurs in the 20s versus postmenopausally. There's some differences. I mean, we'll look for the treatment, yes, there are some differences in terms of what I think will work better than other things, but sometimes we use the same things for both age groups. The workup might be a little bit different. We might be more worried about excess androgens and polycystic ovary disease in younger women than older women. But in general, the workup is the same.
What about for younger men? Is it typically genetic when it happens to men in their 20s?
For younger men, the question was, is it typically genetic? It depends on what you're talking about. Like if it's just general thinning, then yes. If it's patchy or something else, then it would be something else. So the evaluation is for the hair loss to try to figure out what the hair loss is due to.
If it's general thinning, what do you typically find as the cause?
It's usually genetic.
Yeah. And then that responds okay to treatment if it's genetic or?
Usually in younger, usually. Younger and older.
Okay.
How hereditarily connected is what's going on with my sister? I don't have thyroid disease. It may be a little.
I can't say for sure how. Yeah.
And if somebody's hair isn't working or not growing out, is it healthier or better for the hair, like just to cut it really short so there's not that much of a problem?
The question is about cutting the hair short when your hair's falling out. So there's two. It doesn't necessarily help the hair grow better to cut it short, but it does help it look better because if you have less hair, the weight of the hair, if you cut it shorter, then it sits up a little bit better. And it's also, some people will be hanging on to all this old straggly, like the hair that's with the split ends and everything, and it's always better to cut that too. So.
I just had a really quick question. You know, I see these nutritional books and cookbooks marketed to celebrities or, you know, to people everywhere about the thought. I guess the strategy is if you change your diet, you can accomplish maybe not all of these goals, but a lot of them, and that's like a natural way, and that works for all ages. And I don't know if there's any scientific proof or if that's just fancy marketing. I don't know if you have any feelings about that.
So the question is about diet changes and diet fads in a way. So nutrition is a very tricky thing. I think there's probably some truth to some of those things about our nutrition and eating healthily and certain types like omega-3 fatty acids and things like that and inflammation. But there's so much variation in people, and I don't know that any of those things have been studied well in populations. So not enough to make a recommendation.
Thanks.
Is keratin shampoo and conditioner, is it good for the hair or is it harmful?
So the question is about keratin shampoos and conditioners and whether they're harmful or good for the hair. I don't know for sure. I think they're probably helpful in general. However, so theoretically, if you because the hair is made of keratin, the theory is that you wash it with some keratin-based things and you can replace some of that keratin. But I'm not sure if, practically speaking, they actually do work. In terms of harm, it's not likely to be harmful, but I don't know. Any other questions?
My scalp is itchy, and I started using the shampoo called Glen. And I told my hairdresser, she just told me that it's supposed to cause hair loss. You haven't heard anything about it.
So the question is about Wen shampoo and whether it can cause hair loss or not. I have not heard that. I think Wen shampoo is one of those that helps thicken the hair, so it looks like it's fuller, but it doesn't necessarily help hair grow better. I think it's also more conditioning than other hair shampoos, which can feel nice as well. So, you're welcome. In a young male, the most effective treatment for a young man with male pattern hair loss is probably Propecia or finasteride is going to be the most effective at keeping it from getting worse, followed by Rogaine or Minoxidil. Yes, it's FDA approved for use in adult men, so over the age of 18, for hair loss specifically, at 1 milligram a day. Mm-hmm. Okay. Any other questions?
Okay, I wanted to say thank